Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. We continue on hematology course. Now we are going to discuss bleeding disorders. When blood vessels are injured or damaged, we have three processes to occur in order to stop the bleeding and hemorrhage. Number one, immediate vascular vasoconstriction or spasm in response to injury. 2. Platelet plug formation. And 3. Activation of the coagulation cascade. These three processes states that blood vessel must be normal, wall and constituents. Platelets number and function must be normal, and the coagulation factors are all within normal range. Any affection of one of these three may lead to continuous bleeding and problem in clotting. We are going to discuss coagulation disorders and platelets disorders, and we start with coagulation disorders. They are classified into inherited and acquired coagulation problems. For inherited, they are further subclassified into hemophilia A, which is factor VIII deficiency, hemophilia B, which is factor IX deficiency and called Christmas disease, and von Willebrand disease, which is a special entity of coagulation problem together with platelets problem. Other factors deficiency may occur like 9, 7, prothrombin, fibrinogen, etc. Acquired may be caused by so many factors. Number one, vitamin K deficiency. As you know, factor 10, 9, 7, and 2 are dependent on factor 8. So any deficiency of this factor will lead to problems in activation of these 1972 factors, as it is called, and may lead to bleeding. Disseminated intravascular coagulopathy or coagulation. Massive blood transfusion because there is dilution of coagulation factors in the blood. You are giving stored blood. This stored blood is deficient in coagulation factors because of their shorter half-life. So when you give massive blood transfusion, you will dilute the factors inside the recipient's blood. Liver disease, because liver is responsible for synthesis of some of the coagulation factors. And uremia, it may interfere with coagulation cascade. Hemophilia A is one of the important coagulation problems, and it's not uncommon. It results from inherited deficiency of factor VIII. It is X-linked disease, so occurs in males more than females. 1/3 of cases are sporadic, that's to say they are not inherited. They occur for the first time in certain people without known cause. Here, the joint, this is an elbow joint, is suffering from massive bleeding leading to swallowing and redness of the joint, and this occurs usually in hemophilia, because in hemophilia the classical clinical feature is bleeding into joints. This is a knee. Weight-bearing joint in particular, like knee, are more prone to suffer bleeding because of the excessive movement and excessive pressure and weight on this joint. Clinical features of hemophilia: we have hemarthrosis, and hemarthrosis means bleeding into joint. This is the classical presentation, the most important feature in hemophilia. Also, soft tissue bleeds are common. In joints, this bleeding may results in inflammation and stiffness with difficulty in movement of joint, and later joint deformity due to this bleeding and diminished movement of the joint may occur. It may need surgical intervention. Bleeding from the gut and the renal tract also may occur in some cases, and the most serious consequence is cerebral hemorrhage. It may be fatal, of course. Bruises sometimes may occur in hemophilia, although it occurs more with